So often with HMO medicine, we hear that doctors rush their patients in and out of their offices and they don't take the time to listen and be present with their patients, which is why this study on doctor empathy is so encouraging. A patient's relationship with his or her doctor is an important, valued component of healing. And now scientific evidence with brain scans shows that doctors feel their patient's pain and relief after treatment. Now, I know that this isn't new to you, so let's talk about how you feel when you treat a patient.
Oh, I'm very connected to the patient. There's a lot of intention. There's a lot of what I would call, we talk about placebo a lot. We should define that because a lot of the time when we talk about placebo, people get the wrong idea. They think that there's something that isn't accurate, that isn't part of the treatment, that somehow influences how people feel and makes them better. But it's that relationship that the doctor has with the patient that we could call that if we want to, but it's that unknown part that does a lot to help with healing. A lot of people feel it's the relationship that does the healing more so than the medicines and technologies.
Well, you know that if somebody's soothing you or caring and comforting you, that it does make you feel better. It helps your pain. It helps your depression and your anxiety.
And we use that word placebo, it seems to take away from it, but it doesn't if you really know what the word means. It's about having that positive effect from the relationship that's intangible.
Well, the other thing that I really liked about this study was that it showed that when the doctors empathized, that they really felt more satisfied when they could feel the patient's pain.
Well, why did we go into medicine? I mean, what was the point of becoming a doctor?
Because nowadays we don't hear much about that because doctors are in such a hurry.
Well, if there's not enough time, if you can't do two things, one is to listen, and second is to care. You're giving away some of the bulk of what healing is about. We tend to over-focus on curing symptoms rather than we do on healing people, and they're very different. Getting rid of a symptom doesn't get rid of the cause for what happened. Healing is about making that transition so that from the psycho-spiritual side as well as the physical side, we get better.
Well, the other thing that I liked that was in this study was how the relationship can really relieve the symptoms, and the doctor's expectations influence the outcome that the patient has.
Sure, and these brain scans that they did, these functional MRIs, show that when doctors are in the mode of treating people and having an intention for them to get better, that their brains lit up in the same place that the patient's brains lit up. So something was happening there that was kind of magical. Call it placebo if you want to, because it is, but it's real and it's solid and it's the guts of what medicine is about.
So this doctor-patient relationship can actually transform medicine into caring.
Yeah, well, that's what medicine's about. And it's our relationships we develop that have so much to do with whether people are going to get better or not. It's not just the drugs or the surgeries or the technologies. It's what a patient believes, because what they believe has a very powerful effect on their biochemistry and physiology, and that is what does the healing.